7:19. I'm just asking, by the way, Dr. Zach from the MUHC, your physician, about sort of tips on how to eat, and he said, I just do whatever my wife tells me, which is great, by the way. Dr. Zach, welcome back.
Thank you.
Okay, so food aside, that'll be your next segment because I'm dying to get your opinion on all this kind of stuff.
Sure.
You have promised me and our loyal viewers at home a plan on how to survive a trip to the ER, which, let's be frank, in general, it can send you to the different ward of the hospital, the psych ward, and I'm not even kidding. What is, first of all, before we get to your tips, what exactly is happening, not just at your hospital, but at hospitals in general? Do you think that makes it that the ERs are so congested at this point?
And we know that Canadian ERs, people wait longer than the average of other Commonwealth nations. I mean, they've studied that. Definitely part of the problem is access to primary care outside the emerge. So
before you would head to the ER, where would you go?
Like if you have a doctor who you have access to 24/7, or not necessarily your doctor.
Sorry.
Yes, it wasn't meant to be a joke, but
so if we
it doesn't
all
have to be your doctor. It can be an all-call group, right? But if you have access to a primary care doctor, family doctor, someone who can see you for whatever ails you, that doesn't need the emergency department, then that would decant, that would empty the emerge of whatever 30% at least of cases right away.
So these are problems running into each other because you need a family doctor, which
someone you can
sorely
see.
Unavailable for the most part.
Off hours or even on hours. Your family doctor is busy, so he can't just squeeze you in. So
and it's not like in France where there are doctors on call, right? That you can have access to. So. Okay.
So everyone ends up going to the emergency for everything.
Yeah.
So it's just a volume issue.
Okay. So can I ask you, is it true that it's dangerous to be in the ER? Like you can get more sick going to the ER than not going? For like if you're sitting there for 18 hours and someone next to you has meningitis and doesn't know it, like is there a danger going?
Well, I mean that's true in terms of an infectious disease. Yes, I mean anywhere you are that's a public place like a bus or an auditorium.
Correct.
Yes, you can catch that.
Right.
And the longer you're there, the more likelihood. However, I don't think it's necessarily a dangerous place. And one of the things is, things do change while you're in the emerge. And so everyone gets a triage code, right? So the sickest people get seen quickest. If you're having a heart attack, if you're having a stroke, if you were just stabbed or something, you're going to bump everyone who's been waiting several hours, for sure. But
which makes sense. I think most people are accepting of that, right? So I think is that your first tip? Keep that in mind, that there is a triage process.
Keep that in mind, but your triage code can change. So if you're getting sicker, the nurses do every few hours reassess people, and the triage nurses are great, right? They have to make a very important judgment as to how sick you are.
Who gets seen first? Yeah. And they have to deal with a lot. I know. I've seen it. You also say come with an advocate if you can. What does that mean exactly? Come with your cousin who's a doctor, and then just show her around to everyone.
It doesn't have to be a doctor, but if possible, come with someone. Okay, it's not always possible, right? You can't always choose. But if you have someone who can look out for you, who can bring you something to drink or eat, or who can alert the triage nurse if you've gotten sicker, then that's definitely helpful. And the other thing is, you can't always remember everything, so they can come in with you and when the doctor comes to see you.
Yeah, especially if you're in a stressful situation.
Absolutely.
If something has just occurred, it's really good to have that sort of reasonable, calm voice there. You say this is important. A lot of people don't even, I think, have this on hand or even know this offhand, I should say. Carry a list of your regular medications.
Yeah, it's very helpful. Ideally, a list of your regular medications, of your physicians, of your allergies, any important medical history. Some people have like a beautiful printout of it.
Who are these organized people? And if it's laminated, I'm not talking to them.
Some people have it laminated.
It's true. Okay.
But it definitely saves time. Like we do have this DSQ now, the Dossier de Santé Québec, where we can look up medication lists.
Really? So everything's connected.
That's very helpful, and that's new. So before it was very difficult to get people's medication lists, but it'll save time for sure. If I have it right in front of me, it helps.
Avoid like a problem of taking medications that don't go well together if you don't know who's taking what.
And that's a common problem.
This is an interesting one. I think that people hesitate to do. If you're severely ill, call an ambulance. Why? You're skipping the queue there.
Well, not necessarily.
Okay.
I mean, because ambulances, as I'm sure you've heard, can take a while to come.
And are expensive.
And yes, you do have to pay for them. I'm not sure the criteria, to be honest. I don't know if you always have to pay or not. But the good thing about ambulances is that they can start treatment right away, right? I mean, first of all, they triage as well. So if it's life-threatening, they come right away. They can get you through traffic quicker, and they'll start treatment. And the other thing is they know where to go, because things are, as you know, things are parceled out now. So certain hospitals, like for example, the Vic is a heart center.
You've got your trauma centers.
The trauma
everything
is at the Montreal General. Yeah. So if you don't know where to go, you can walk in with a heart attack to the Montreal General. We can treat it, but we'll still end up probably transferring you to the Vic for an angioplasty or whatnot.
Listen, we've run out of time. Finally, I guess you're speaking for all of the art physicians out there. What would you like us to quickly keep in mind about your state of mind as you're dealing with all of this?
And not just the physicians, all the staff,
Nurses,
the
support
nurses,
staff.
because they're like the front line. Honestly, people are trying their best, and we're not unsympathetic to the fact that you're waiting a long time and that you may be in pain, and we really do care, and it's really a great staff. But sometimes, yes, there's going to be a wait, depending on if there are 30 other people waiting with potentially more life-threatening problems.
They got to be seen first. Dr. Zach, thank you so much. Listen,
you.
many people are going to be trying to keep your words of wisdom in the back of their minds as they try not to lose their minds. Thank you so much for joining us.
Yeah.
Once again, ER physician for the MUHC. For more, by the way, btmontreal.ca/blogs. For more of his, what's going on in that fantastic head of his, stay tuned. You're watching BT on